Good morning, good afternoon, good evening. Thank you for joining this webinar, Nutrient Profile Model, a position paper, which is a valuable tool for developing healthy food policies. I am Veronica Schoj. I lead the Food and Nutrition Program in the Global Health Advocacy Incubator. And I had the privilege to be presenting this Nutrient Profile Model joint publication that is the result of a collective effort developed in collaboration by my organization, the Global Health Advocacy Incubator, together with the Global Center for Legal Innovation in Food Environment from the O'Neill Institute in Georgetown University, Resolve to Save Lives, and Vital Strategy. I want to thank all these organizations and the teams of our organizations for this huge effort and to achieve consensus for this publication. And also I want to thank the Food Research Program from the University of North Carolina, Chapel Hill, for their contributions. Last, I want to thank the 65 organizations that across the globe provided the endorsement of this position paper. And welcome again for joining today. This webinar will have two sections. First, I will present the position paper in collaboration with Evelyn Gitz. Evelyn is my colleague at GHAI, senior advisor, nutritionist, PhD, expert in public health nutrition. And the second section will be the moderation of the panel, discussion panel that will be moderated by Esubalew, Dadi, also our colleague in GHAI. He is a lawyer and the food policy director for the African region. He will be moderating the discussion panel that is integrated by representatives of all the organizations that are co-branding and developed together this publication. There is a section of questions and answers, so for the audience, please feel free to send your questions. And there is available simultaneous translation in Spanish and Portuguese. Before jumping into the presentation of the position paper, I wanted to briefly mention what is the problem we are trying to solve. Unhealthy diets produce overweight, obesity, and every form of malnutrition. And the consequence is the increase of NCDs, non-communicable diseases, including diabetes, cardiovascular disease, hypertension, cancer, and their attributable morbidity and mortality in all the regions of the world. Food products that contains excessive amount of unhealthy nutrients of concern, nutrients and ingredients of concern like sugar, salt, saturated fat, trans fat, and also non-sugary sweeteners are typically markers of processed and particularly ultra-processed products that increase all forms of malnutrition. I want to highlight the fact that it's not just overweight and obesity. Ultra-processed products increase all forms of malnutrition. There is a clear evidence that when the ultra-processed product increase, the healthy diet and the essential micronutrients consumption decrease. And that's why governments should take immediate action to reduce the consumption of ultra-processed products and flatten the curve in those countries where still the consumption is low but growing. The massive availability and the aggressive promotion of the ultra-processed product contribute to the creation of unhealthy environments, which threaten the enjoyment of the right to health, the right to food, and other related rights. And only through a package of food policies, mandatory and evidence-based and free of conflict of interest, mandatory policies, we can transform those unhealthy environments and provide transparent and accurate information to consumers and make the healthy choices more affordable, more available, and ultimately the preferred options. Nutrient profile models are an essential tool to design food policies. Next slide, please. Yes, well, I think we already mentioned this, so we can move forward. You have simultaneous translation and questions and answers. Next slide, please. So what is a nutrient profile model? According to WHO, a nutrient profile model is the science of classifying or categorizing food and drinks products according to their nutritional composition for reasons related to preventing disease and promoting health. Nutrient profile models are developed to categorize food and drinks products and establish thresholds of nutrients of concern, and should also include non-sugary sweeteners and potentially other ingredients and additives in the future, like flavors or colorants that are harmful to health when consuming excess, and therefore should be limited in standard diets. Next slide, please. Why it's important to define a robust nutrient profile model? The goal of a nutrient profile model is to discourage consumption of unhealthy products that are excessive in nutrients and ingredients of concern, which can reduce diet quality and harm health. Nutrient profile models are applied as a tool to guide the design, implementation, monitoring, enforcement, and evaluation of various policies, including front-of-package warning labeling, marketing restrictions, regulation of school environments, school food procurement and school food services, food procurement in other public institutions, taxation, social programs to protect vulnerable population, among others. Next slide, please. Why we don't include it in the position paper, nutrients to encourage? What are the reasons to not include nutrients to encourage in a nutrient profile model? The nutrients to encourage, like fiber, vitamins, protein, don't reduce the health damage associated with excessive nutrients and ingredients of concern. It's biologically impossible for this, the content of fiber or vitamins or proteins to offset the adverse impact of sugar or sodium, for instance. Nutrient profile model scoring systems like the Health Star rating, the Food Compass, the Nutri-Score integrate nutrients to encourage with nutrients to discourage into a summarized score. These systems don't allow consumers to understand individual levels of nutrients and ingredients of concern. Merging or adding information about nutrients to encourage into a nutrient profile model then will divert the purpose of the policy, decrease its health effect, and increase consumers' confusion. The nutrient profile model scoring systems, like the one I mentioned before, mirror the positive nutrition approach that is a multi-component and very sophisticated strategy developed by transnational corporations to position the ultra-processed product as a full solution to hunger and undernutrition. Next slide, please. Why we created this nutrient profile model position paper? The sense of urgency that all this group of organizations felt was related with the fact that in many countries where we are supporting advocacy campaigns to promote food policies, we saw that nutrient profile model is a main obstacle to move forward because it's technically complex and we need to make it more easy to understand and accessible for decision makers and other audiences, because there is a lack of unified international standard about nutrient profile models. There is a great need to generate local evidence to support local policies, but with clear standards and based on robust global evidence free of conflict of interest. And also because we saw, observed, and well documented that nutrient profile models are the focus of industry interference to undermine food policies. Next slide, please. So how the industry hinders the adoption of nutrient profile model? The industry, the food and beverage ultra-processed industries, developed a sophisticated and comprehensive playbook to jeopardize and undermine nutrient profile models across the globe. They do through a variety of strategies, for instance, opposing the use of best practices. For example, the PAHO, Pan American Health Organization nutrient profile model, was opposed in every single country in the region of the Americas when it was proposed, and the industry aggressively and publicly opposed the PAHO nutrient profile model, but we documented opposition from the industry in other robust nutrient profile models in Africa and Asia. The industry also proposed nutrient profile models that are based in serving size, which are easier to manipulate. Also lobby to exclude more food and beverage groups from nutrient profile model that, of course, will reduce the scope of the products affected by the policy, and also promote less strict thresholds for nutrients and ingredients of concern to reduce the scope of the products included in the policy and protect their company brands, which can, of course, also dilute and the potential impact of the policies. The industry also establishes nutrient profile models based on the market offer and not based on science and consumers' health protection. We also documented that the industry pushed for a higher number of food categories in the nutrient profile model, which create more thresholds to establish, to monitor, more work for the government. It's more complicated to enforce, and more room for industry to manipulate. And as I mentioned before, normally industry lobby to introduce nutrient profile models that are based in scoring systems, highlighting the nutrients to encourage. Next slide, please. So in the last years, all World Health Organization regions publish their own nutrient profile model, but they are very heterogeneous. So, for instance, the nutrient profile models published by the Eastern Mediterranean region or the Europe region or the Western Pacific region only focus in restricting marketing to children. So they are not applicable to other food policies. But Pan American Health Organization, Southeast Asia region, and African region, PAHO, CRO, and AFRO nutrient profile models are more comprehensive and classify products as having an excessive amount of nutrients of concern when the proportion of such nutrients in a product exceeds the WHO recommended maximum intake. That's why in the nutrient profile model, the PAHO, CRO, and AFRO nutrient profile model in our position paper, we recommend these three regional nutrient profile models because they align with WHO recommended intake limits for nutrients of concerns, including threshold adjusted according to energy requirements, also known as caloric denominators, which can be applied for the entire population, including children, and only for two categories, solids and liquids. And last, next slide, please. I want to talk a little bit about the benefits of adopting a regional model versus designing a complete new model at the country level. Of course, acknowledging that the countries have always the right to design their own nutrient profile model, we recommend in the position paper the adoption of these regional strong rigorous standards like PAHO, CRO, and AFRO nutrient profile models because they require fewer resources and a shorter timeline for policy design and implementation, but also because the use of these regional frameworks help with possible political, judicial, and administrative challenges imposed by industry, what happened in every single country where policies were approved using strong nutrient profile models. That said, if the countries decide to design their own nutrient profile model, we recommend that use this strongest standard as the floor and try to build on that and monitor the implementation experiences in other countries and all the emerging evidence that could further improve the policy standard to push the envelope for a better and more protective policy to protect the right to food and the right to health. I will give you now the floor to Evelyn to continue with the presentation, and thank you so much. Evelyn, the floor is yours.
Thanks so much, Vero. Good morning, everyone. Good evening. So this is our nutrient profile model position paper. This was published, and this is in the website of GHAI, so you can access to this document. Here, we can see the content of the nutrient profile model position paper. And again, thanks a lot for the organizations and all the people that contribute to publish and to develop this document. Next slide, please. Thanks. So I will share with all of you some key technical components of the nutrient profile model. So we can summarize this saying that ideally the nutrient profile model should be consistent with the WHO recommendations. As Vero mentioned, the WHO recommendations are limited to the ingredients and nutrients of concern that are outlined in the WHO population nutrient intake goals. So they are based in the daily energy requirements for the diet for all the groups, including children. The second point that is really important, that should be relevant for all the populations across populations, should be applicable to the country general population and not for special subgroups, like for example, to develop only one nutrient profile model for children. Other key component of the nutrient profile model is that should include threshold for nutrients and ingredients of concern that are associated with NCDs and also that are markers of UPPs, like for example, trans fat, saturated fat, sugars, sodium, and also non-sugar sweeteners. Other key component is that should be applied only two categories, solids and liquids, because if we apply more than two categories, can be really complicated to implement, but also is easier for the food industry to manipulate an interference in the design of the nutrient profile model. So that is why we said only two categories, solids and liquids. And then the model should be applied and should use only one threshold for sodium, for solid, and one threshold for liquid. And the last comment that is really important, we apply the nutrient profile model only to processed and ultra-processed products. We don't apply the nutrient profile model to natural products and processed products or culinary ingredients or fresh food, among others, only to processed and ultra-processed products. Next slide, please. So this is because we understand that these products, ultra-processed and processed products, are with a lot of and high amounts of sodium, free sugar, saturated fat, total fat, and trans fatty acids that are added by the manufacturer. And also because there are a lot of studies and research that mention that if the diet has natural products, cooking ingredients, they adhere to the WHO recommendations intake goals for the WHO population. So that is why we said that only we apply the nutrient profile model to processed and ultra-processed products. Next slide, please. And here we can see different image regarding the guideline from WHO. As we said, the WHO nutrient profile model, the PAHO, the CIARO, and AFRO that Vero mentioned before, align with the WHO recommendation intake limit for nutrients of concern. That is, this is connected with the energy requirements that we have that also are known as caloric denominator. And this can be applied to the entire population, including children. And this is important because this is a difference with other nutrient profile models. We know that there are some models that use 100 grams or models that use per serving size and as the basis of the threshold for the nutrient profile model. And these kind of nutrient profile models doesn't meet the public health objective of achieving WHO recommendation intake targets. So also these kind of models, they assume that all population groups have the same energy requirements and maybe apply a higher load of critical nutrient for child population, which we know that they have a lower requirement of energy than the adult population. So that's why we say again that this caloric denominator that PAHO, CIARO, and AFRO, the WHO nutrient profile model, applies, can be applied for across the population, including children. So this is really important. But also, we know that, for example, the nutrient profile models that has and that use 100 grams or use serving size as the basis allow the reformulation of products, ultra-processed products or processed products. And this interference, the industry interference there, they reformulate the products. And this is very, we have the example of, for example, the the beverage, the sugar beverage, that they manipulate the basis, the threshold to change and try to allow to for example, remove the labels of the products. And with the caloric denominator doesn't happen. Always we are going to see that has the label, for example, of non-sugar sweeteners or excess of sugar. So this is really important because the industry can manipulate the threshold in 100 grams or serving size, but with the caloric denominator, the food industry cannot manipulate that interference in their products. Next slide, please. And another important point, why we add non-sugar sweeteners to the nutrient profile model. There are different studies and research, and we learn from the experience of Chile. Chile was the first country to design the nutrient profile model and implement a mandatory healthy food policy, and was really important in that moment, and we learned a lot from Chile. But Chile in that moment didn't include the non-sugar sweeteners. And what happened is that the industry reformulate their products, replacing sugar by non-sugar sweeteners. So what happened is that a lot of products, they remove for example, the front of package labeling because they replaced by non-sugar sweetener, and non-sugar sweetener was not included in the nutrient profile model. So also the consumption of non-sugar sweetener increased in the population in Chile. So this was really important to understand and to learn from the Chilean experience. And this is something that Mexico has learned and has improved the nutrient profile model, especially including non-sugar sweeteners. And also because we have a document that was published last year from WHO explaining the details and the result why we don't recommend the use and the consumption of non-sugar sweeteners. Next slide, please. And here in this table, we can see the difference between PAHO, AFRO, and CIARO. The three nutrient profile models use caloric denominator, but there are some minor differences between them. For example, PAHO nutrient profile model doesn't divide products into solids and liquids, but includes trans fatty acids and also include non-sugar sweeteners in the nutrient profile model. While CIARO and AFRO do divide solids and liquids, but establish a stricter standard than PAHO, especially for free sugars in beverage, 5% limit of total of energy. So with this table, and basing these comparisons and lessons learned from Chile and the improvement of Mexico nutrient profile model, we have developed and we have discussed with the global partners and different organizations what is the best model and the highest standards for the nutrient profile model. Next slide, please. So we have developed this table that is the best standard, the highest standard, that includes these kind of things, includes non-sugar sweeteners, as PAHO includes non-sugar sweeteners, and also learning again from the experience of Chile, but also includes the change in sodium that was an improvement developed by Mexico and then was also taken into account by Argentina and Colombia. They included that in the nutrient profile model. And this is why we summarize this table as a highest standard to include and to design a nutrient profile model. Next slide, please. So to finalize the presentation, we want to share the experience of Mexico. This is also included in the position paper because Mexico was an emblematic case and inspiring also case because building the experience from PAHO nutrient profile model and basing the PAHO nutrient profile model that was the strictest nutrient profile model at that moment, Mexico analyzed the experience of Chile regarding non-sugar sweeteners and also include non-sugar sweeteners there, but also include caffeine because we know that it's not recommended in children, and improve the sodium threshold by consuming the high caloric density products. So this was really innovative and improve the standard for the entire world. Again, that's why Argentina and Colombia learn from the experience of Mexico. And that is why we recommend that it's really important to keep monitoring the emerging evidence and lessons learned, and to continue improving the standards to protect the right to food and access to adequate food. So thanks so much. I will give the floor to my colleagues.
Thank you, Eve. Thank you, Vero, for the presentation. Good morning, good afternoon, everyone. My name is Esubalew Dadi, and I'm the Africa Director for the Food Policy Program. I will be moderating the question and answer session now. And I will be starting first by introducing the list of panelists that we have. And first is Trish Cotter, who is the Senior Director of and Global Policy Lead of the Food Policy Program at Vital Strategies. Laura Cobb, who is the Director of Nutrition and Surveillance at Results Save Lives, and Isabel Barbosa, of an Associate Director at the O'Neill Institute at Georgetown University, and also Veronica Schoj, who is the Vice President of the Food and Nutrition Policy at GHAI. And I think it's a logistical point I would mention here is we have 20 minutes, so I'll be starting with some guided questions, but also entertaining questions from the audience. I would really encourage the audience to share questions in the chat, and we will be monitoring those questions and bring them to the attention of the panelists with available time. I would also say that I think even if we are done with the webinar, I think we'll follow up with the answers to those questions that you may have, and we will share the slides and also the contact details of the panelists. So with that, I would proceed to the first question, and that question goes to Isa. And that question would be, from a legal standpoint, how do we ensure that the laws and regulations are adequately reflects all the best practice nutrient profile model requirements as recommended by the position paper?
Thank you, Azu. I wanted to start by thanking the Global Health Advocacy Incubator for the invitation to join this panel. It's a joy and an honor to be here with all of you. And also thank you, Azu, for the question. It's an interesting one and quite comprehensive. But I think I would start maybe just highlighting the importance of preventing and addressing industry interference in policymaking, and just thinking about the role of law and regulations in establishing sound governance mechanisms that can help these processes evolve according to the best available scientific evidence, and really establishing the rules of engagement with industry actors with a lot of clarity, and then allowing for the challenging of these industry actors if they cross these lines and cross these boundaries. So I think that's the first important point that I wanted to bring. And especially thinking about food policies that have been established in different countries in Latin America, we have examples of how the industry first tries to kill some of these policies as they evolve. But then when they see that they won't be able to do that, they try to water it down and water down their effectiveness. And I think this conversation about nutrient profile models showcase some of this, right? Industry, many times, what they try to do is weaken the nutrient profile models so that they can get away with less effective policies. So that goes to the argument of really making sure that industry interference is prevented and addressed. And then the second point that I wanted to bring is just the importance of having clarity on the objectives of such policies when we're thinking about legal and regulatory processes. And this position paper, I think, does an interesting job, a great job at stating what the objective is, right? And it goes to say that governments should take immediate action to reduce the consumption of UPPs, of ultra-processed products. And then it also links that to nutrients and ingredients of concern, right? And it says that that considering certain nutrients and ingredients of concern are typically markers of processed and ultra-processed products. So I think that way of framing the conversation and framing the objectives are very interesting from the legal standpoint, because it allows us to keep inside evidence as it evolves and adjust, right? And as we keep researching other markers of UPPs, that we can try to adjust the models to incorporate that. So I think I'll stop here with these two examples. Thank you, Azu.
Thank you, Isa. That's an excellent, explanation. And if I may add also one point regarding to that is in the, nutrient profile model in the legal framework, it's important to articulate and clearly define and incorporate that in the actual bill, because in some contexts, the nutrient profile model may not, be part of the draft bill or regulation, and that may open the door for loopholes, legal loopholes, and may even undermine effective implementation of the bill itself, actually. So I think that would effectively complement your point, and thank you for that explanation, Isa. I think my next question would be to Laura, and considering Resolve to Save Lives experience in promoting the use of the nutrient profile model, why do you think scoring systems are not useful? And maybe if you could tie that with what scoring systems are and why they are not useful from a policy design perspective. Thank you.
Sure. So Vero touched on a bit of this in her opening remarks, but just to say, scoring systems are where you take multiple nutrients together and you use the levels of these multiple nutrients to create a single score. I think one of the things, at its face, it seems like very appealing, right? Because it allows for just one picture, one number, one whatever on your 1 star, 5 stars, whatever it is, on your box. It covers everything. That's really great. But it also allows you to include not just the critical nutrients we talked about, but also positive nutrients. So what could go wrong? Well, it turns out that, as Vero mentioned earlier, if you include positive nutrients, it's easy to game the system. So in India, for instance, where there are positive nutrients on the proposed regulation, there's a lot of concern from actually local Indian manufacturers that this will give international companies an edge, because they have more resources to be able to figure out how to sort of add more fiber, for instance, to their foods or whatever, so that the same, cupcake all of a sudden has more fiber, and instead of having 2 stars, it now has 3 stars and it looks healthier. And, a manufacturer with less resources doesn't have the ability to kind of innovate in that way to compete. So that's one aspect that's problematic. So is the inclusion of these positive nutrients. And because it's a single score, it's actually a black box, right? So you don't know what's going on in there. So if you are concerned because you have hypertension and you need to reduce your salt, you can't get any sense. You could be like, oh, this looks great. It has 4 stars. Well, actually, it's extremely high in salt, but it happens to be low in sugar and fat. You have no, or it's 80% fruit or whatever it is that, so it's not, helping you make sort of clear decisions for yourself. And then I think, and then the other thing that can happen, and what we've seen in some places, is that foods that are categorically unhealthy, like Coca-Cola, may not be at the lowest of the low. Maybe they're like, they don't have the high salt, so they're 2 stars. So then you're like, this is weird. So Coke's okay because it's 2 stars. So I think it's really can be very confusing. And as Vero mentioned, I think very rightly in her introduction, they do kind of build on these initial industry proposed scoring systems that were put out in the early 2000s. I can't remember what the one was in the US, but that wound up being discredited because Fruit Loops wound up getting like an A. And they were like, okay, well, that doesn't pass the sniff test. And obviously many of these are much better than that, but they're still very confusing and hard to understand. And I think the final question is, and what we think about is, how do they also make consumers act? And so are consumers going to be driven to really change their behavior based on kind of whatever the pictures are based on the scoring system? And the answer is, what we see so far is that warning labels have a stronger ability to make people act. So I did just want to add that in as well. I'm sure there's lots of other things, but I think I'll pass it back to you, Esu, for the rest of the panelists.
Thank you, Laura. And if there are additional comments on that, Vero, maybe I would also invite on this specific point. But I think I could proceed to thank you, Laura, for that excellent explanation of why we need to be clear about that element, particularly why scoring systems aren't a useful element in terms of setting up the nutrient profile model. So I really appreciate that insights. I think the next question I have is for Trish. And the question is, from, how can advocates utilize the nutrient profile model position paper, and what do you see as or perceive as the value of, this position paper for the work that you are doing? If you could elaborate that for, from advocacy standpoint as well. Thank you.
Thanks, Isu, and happy to be here, and hello to everyone. Look, this document really equips advocates and decision makers with the information to select the highest standards for their country. So if you just think about Laura's comments just now about how confused consumers can be, the other thing about consumers is they really do expect standards of all sorts on all types of things that apply to product safety. Everything from the safety of their cars they drive or to the construction of the homes that they live in. So, why not for the food that they feed their families? And, this is because, and we all need a nutrient profile, a robust nutrient profile model, because unhealthy food cannot be safely consumed. So, and to achieve a robust standard, we really need those standards to be free of conflict of interest. So what we've got here in this position paper is sort of the bedrock for advocacy about providing that scientific and evidence-based approach. But one of the things as advocates we're really always aware of is, well, who's going to oppose what we're doing? And we know that the industry will, definitely confuse and manipulate the process by pushing, for example, for nutrients to encourage or the rating systems that we've heard of already today. And, the problem with these approaches is that you can't just add one good ingredient and wipe out the harm of an ultra-processed product. It's still an ultra-processed product. But the result of having a nutrients to encourage approach is it's exactly what the industry wants. It allows them to promote and produce products, ultra-processed products, as healthy under a health halo, and when really they're just the same product. They're an ultra-processed product. Now, we know that, the industry behavior is pretty predictable. We've seen the way they've managed to try and influence the way these systems have been implemented in many of the countries that we've worked. So when we do understand how they work and what their tactics might be, it's a lot easier for us to counter them and also help our policymakers counter them, because it's often the policymakers that are upfront in the media defending the nutrient profile model that they're proposing for their country. So if we can design clear messages for communication for these policymakers, we'll be not just good advocates, but we'll be good partners for the introduction of a nutrient profile model. But those tactics, I think we've already talked about them a little bit. They will create opposition and doubt around best practice. That's a guarantee. It's standard fare for the industry. They'll propose, a model based on serving size, which won't be effective. They'll apply pressure to change the threshold levels. We know that. They'll try and structure things around the way their market is established, not around the science that we base everything that we do on. We know that they'll even lobby to introduce their own models, so that, suggesting that theirs might be better and more appropriate. But really, that's just so that they can continue with their status quo. And the other thing that I think is really important to keep in mind is that they'll often say, oh, look, we'll look after it. We'll introduce an industry-wide voluntary solution. And again, we all know that those voluntary pledges that industry make are not going to be enforceable. They're not effective, and they won't achieve the outcome that we want, which is to protect our population from unhealthy products and enable them to access they're right, really, to healthy food. So there's plenty of fodder there for an advocate, that's for sure. And and again, I want to thank the incubator for taking the lead on the production of this position paper. It's terrific.
Thank you so much, Trish. That was really insightful from that, clarifying for how advocates would be able to utilize the nutrient profile model and the importance of really focusing on a strong and robust NEPM in the process of defending the policies and also countering the industry's efforts to undermine the policy process. So I think that's a really great. I think my next question would be for Vero, particularly from the perspective of whether we should adopt the nutrient profile models as it is, or should it be adopted by the region itself. Maybe if you comment on that, factoring in the different contexts from a sodium or sweeteners perspective, or other considerations that are different across regions. So we would like to hear your perspective on that.
Thank you, Esu, and thank you everyone for joining the webinar, colleagues. As it was presented before, and we as global organization are supporting campaigns to promote policies that require a strong nutrient profile model. We see a lot of discussion in different territories and different countries how to adapt the strongest standard possible. So we are not saying that should be applied exactly like this. For instance, in Africa, there are currently several countries discussing front of package labeling, and for that they require strong nutrient profile models. So, and that is the case in Ethiopia, in South Africa, in Kenya, in Tanzania, in Uganda, in Ghana. What we recommend is to not just to adopt the Afro nutrient profile model. That is not what we are trying to say. We are saying that adopt the highest standard, taking the best of each of them. Because as Eve mentioned, there are some aspects of the Afro and Sierra nutrient profile model that are the strongest, but there are some others that are the strongest in the PAHO one, and there are some improvements that were done, led by Mexico in several countries. So we recommend to use the regional one, test in the country, and compare different nutrient profile models to the local products and market, to have local evidence and decide what is best for the country, but always trying to push for the highest standard possible. So, and I would like to add to that in every single country, I mentioned some countries in Africa where this discussion is happening and where the nutrient profile model is being the key element that is delaying the progress of an FOPL or marketing restriction. That is exactly the same that's happening, for instance, in the Philippines or in India. So it's not just in Latin America where this movement started many years ago, and it is continuing, because right now we have Central American countries fighting, El Salvador, Costa Rica, Guatemala fighting for strong FOPL, or countries in the Caribbean region like Jamaica or Barbados, and we see the same discussions and industry opposition everywhere. Of course, the warnings labels, as was mentioned, are the strongest, and the industry is going to try to avoid warning labels. But if that discussion is solved and the warning labels are accepted, the bigger opposition will come to try to dilute the nutrient profile model. We saw a shift in the last 5 or 6 years where the nutrient profile model is the key element to undermine all these policies, not only FOPL, because nutrient profile models are essential for marketing restrictions, for school food environments, for food procurement policies. So that's why it's so important to develop the technical capacity in academic and civil society organizations to simplify the system so decision makers have the resource they need to apply in their country context and avoid delays, long delays in the policy design and implementation. Thank you, Esu.
Thank you so much, Vero, for those comments and insightful points regarding the importance of considering the different elements in adopting and implementing the nutrient profile model. I think we have some additional questions that are coming from the audience as well. I just want to, flag them, for the panelists to address. I think, one of the questions is tied to maybe, how do you suggest to determine a product if it is processed or ultra processed? Is it with another, profiling model such as the ANOVA classification? This is a question that comes from one of the audiences. So I would maybe open this for maybe Vero to start or and others to comment on as well. And then there are additional other questions I would follow up.
I pass over to the panel. Please jump in.
I'll just jump in really quickly because I just wanted to say that, NOVA is obviously the most well-known classification system. And but I do know that NOVA is also controversial in certain places, and though it's well accepted in many countries in Latin America, that's not true everywhere. And what I wanted to say about this nutrient profile model is it really doesn't rely on NOVA because, it really relies on, you can say, as Eve said, we don't want to apply it to food in its natural state. But there's different ways of thinking about how you define processing, but ultimately ultra processed food in this version, is not in and of itself, a definition of the nutrient profile model. It applies to processed and ultra processed foods, and they need to basically, and at certain thresholds of critical nutrients. And those thresholds of critical nutrients are based on WHO guidance, which is very well accepted and is, something that's based on very rigorous research and science. So I think, I just want to say that I know that a lot of people in this room are very passionate about ultra processed products, but others are coming from places where that is more of a challenge and something that, would be more controversial in your setting. And so you can, depending on what makes most sense for you as an advocate in an area, you can think about it in different ways. Vera.
Thank you so much, Laura.
If I can complement with that and agreeing with Laura, we had a huge discussion in the working group to define this, and we decided to focus in nutrients and ingredients of concern because we have the evidence there. But there is an emerging discussion across the globe to consider potentially other markers of UPPs or ultra-processed products, because we know that there are some scientific publications that demonstrate that collectively, if we take sugar, salt, saturated fat, flavors, and colorants, probably we will, if we have these nutrients and ingredients, probably we will capture over 90% of the ultra-processed products. So there is a question if there could be a nutrient profile model focused in the level of processing of the food. There is not yet a clear evidence as to support that, but that's why we wanted to propose the best standard possible based on the current evidence, but we need to keep an eye open to continue monitoring the evidence, because as we mentioned a couple of times, all the time we have emerging evidence that could help us to improve the standards. And we are not closing the door for the opportunity to have a different categorization that could be the NOVA classification or other in the future.
Also, if I may also complement. No, I just wanted to comment that from the legal standpoint, one way to think about this is having the nutrient profile model be a way to make operational these categories of some processed and ultra-processed products. We have many colleagues who have been thinking about this, some researchers from Brazil, of course. But it's interesting to note that not necessarily these categories are opposing and clashing categories that need to be reconciled, but rather categories that can work together if we think about this from this operational perspective. And we're seeing that happening already in some legal norms that have been emerging in the region of Latin America, where they are working together. And so I just wanted to bring this in from the legal standpoint.
Thank you, Isa. Thank you, Laura and Vero, for those clarifications on that question. I have another question in the interest of time that I would like to mention here for the panel. One of the questions says, it was mentioned that it is important to limit the nutrient profile model categories since it is easier to manipulate. Is there an example for this? And I wonder what is the measure taken to allow for a strict nutrient profile model. But it also adds that for rooms to, it says allows for room for more products to be added. It's a question that try to understand examples that are tied to limiting nutrient profile model categories and the measures taken to that end.
I can start answering that, and please, colleagues, jump in and complement. I think in every single country where there is a discussion about adopting a policy that requires a nutrient profile model, there was an intention to weaken the nutrient profile model. We can talk about specific examples like Peru, Brazil, Uruguay, where, and that's to your point, Esu, it's so important to define in the policy from the very beginning, not only the other components of the policy, if it is FOPL, the graphic design, or if it is marketing, the specifications about the marketing restrictions, but also include the nutrient profile model in the policy design. Because otherwise, if it is this component is not included in the policy and should be regulated after a complementary regulation of the policy, that opens the room for industry interference. And that is what happened in Brazil or what happened in Uruguay, or Peru. In Peru, we from the law until the regulation of the law happened several years. And despite the graphic design of the FOPL was strong, there was a weakened nutrient profile model. So there are many experiences and we face, that's why it's so important to take the lessons learned and from other countries. And for that, I would like to invite everyone to consult the industry interference annual report we published in GHAI, published in 2021, describing all industry tactics across the globe, comparing dozens of country experiences and how the industry tried to interfere, particularly with FOPL is that report, but many of those cases are related to interference in the nutrient profile model. So, and we published another report in 2022 related to the industry playbook related to marketing, where also we see that many times the restriction is related to try to weaken the threshold, so the marketing restriction has less impact. Over, Esu.
Thank you so much, Vero. Other additional points on that from the rest of the panels?
So if I may jump in?
Yes, please.
So it was interesting. I was reading the question again, and I think it's about also this balance between making sure that we have comprehensive nutrient profile models, but also making sure that we have some room to adapt as evidence evolves. So I just wanted to go back to an earlier point that was mentioned by my fellow panelists, which is the fact that, what this encourages is taking the best from the certain models that are included in the position paper, but also understanding that, we might have other experiences that make them stronger, and then learning from those experiences as we evolve. And I think it was Vero that was mentioning that this was precisely the case with Chile, and then later on Mexico. And the addition of non-sugar sweeteners actually responded to that and adapted to make the nutrient profile model even stronger. So I think at this point, what we would encourage is really making sure that we are combining the strongest points of the nutrient profile models that are suggested in the position paper, but also understanding that when this plays out, it may be that even stronger elements start to arise and that they will be incorporated as this happens. So I just wanted to also bring this to the discussion.
Thank you so much, Isa, for those additions. Any other additional points? If not, then I have more questions coming from the audience. One question is regarding, are there any key considerations or key issues to be considered for the Eastern Mediterranean region NPM, which is not covered in the nutrient profile model, but I think we focused on the PAHO, the CIRO, and then AFRO, but there is a question tied to what are the things to be considered for that region NPM, if anyone would like to take that.
I would just want to take a really quick stab at it. I mean, I think the position paper lays out a lot of our positions on what it would be, but I think, one thing that I think is just important when thinking about the previous WHO regional NPMs is just to think about the fact that while the NPMs really started with the idea of marketing to children, right now they're really being thought of and applied to lots of different policies. We're looking at, and what has been shown in the Latin American context is that having a single NPM applied to multiple policies is just, it's not only effective and impactful as shown by some of the research that's been coming out on Chile, which is, we haven't really seen that level of evaluation from other places, but, the research on Chile is great. And it's so simple, right? It makes sense. It all hangs together, and it just, and so tying your marketing into your front of pack label, into your, school food, and in Colombia, even into, junk food taxes, it just really makes it easier for enforcement and also just for consumers to understand. And I think that I just can't stress enough how important that is. So it's not a specific, but just, I think, a really helpful thing to think about. And I'm pretty sure, I don't want to speak for WHO here, but I know that that's certainly on the radar.
Thank you so much, Laura, for that clarification on this question. Any additional points on that?
Yes, so if I can chime in and complement, the three main reasons why, for instance, WAPRO, the Western Pacific Nutrient Profile Model, was not included as a recommendation, as Laura mentioned, is just focused in marketing to children. It's not efficient to have a nutrient profile model for every individual, for every single individual policy, neither a nutrient profile model for a segment of the population, in this case, children. But also because this nutrient profile model doesn't base the standard, the threshold in WHO population nutrients intake goals that was mentioned by Eve, that is based on daily energy requirements that are the best standards. And last, we insist with a comment that it has 18 categories, and we think that having only 2 categories, solid and liquids, is the best way and simple way for governments, not only to apply to design a policy, but also to implement and enforce it. Those are the reasons why, and we encourage all the, the regions and the organizations to challenge, themselves and their standards and try to push the envelope for stronger standards, because the evidence is growing and is clear. Thank you.
Thank you so much, Vero. Thank you, Laura, and everyone for the, I think, insightful comments and clarifications of the questions, the guided questions from the audience. We have many questions, but in the interest of time, I think we will certainly follow up with those questions. I think the panelists' contact details will be shared right after the presentation, including the slides, and certainly we'll make sure that those questions are addressed. We're capturing them in the chat, and then we'll follow up on that. I think I would like to make a couple of reminders. We have a survey that we are going to put out now, and we really appreciate your feedback to today's conversation about the nutrient profile model and the different concepts highlighted on that. And I think we can go from there, and we will follow up by, right after this with the PowerPoint slide as well. And thank you so much for the great panelists and also the attendees. The audience, really appreciate your insightful questions, your contributions to this conversation. I hope this is not the last. We'll certainly follow up with more in the months to come. So again, thank you so much for your time, and have a wonderful day. Thank you again.